Hey everyone, let's talk about aging gracefully. What do you need to do to age gracefully? I'm a doctor of acupuncture and Chinese medicine, and I'm board certified. I'm a licensed acupuncturist, and this is my 25th year in practice. And some of the things I want to bring up are some of the things that I have been practicing since 1994. As a student when I was 20. I'm 50, and at this point, I feel that I'm at least somewhat qualified to share with you some of the great things that I've done for myself for the last 30 years and also for my patients. If you go on my website, Elements in Harmony Acupuncture and Chinese Herbs, you'll see some of the remarkable, amazing things that we're doing. I just created a new webpage. It's just look up WHOA, whoa dash, it's elementsinharmonyacupuncture.com, and I believe the URL, just look up whoa acupuncture can do that, and put a bunch of dashes, and I'll put it in the link. But the first one that we talked about was severe headaches, severe, not just I slept wrong. I'll let you watch that video. I just recently posted it on my YouTube channel. And then the second one that I just posted, like, whoa, I didn't know acupuncture could do that, which is brain hemorrhage and migraines. I specialize in the most challenging cases, the most challenging pain cases, the most challenging fertility cases. There's so many things that the powers of Chinese medicine can do. But one thing that I really want to talk about is growing old gracefully. I was brushing my teeth this morning, and then I thought, I really need to share. I felt compelled. I really need to share some of the things, some of the cognitions, and some of the aha moments I had when I was 26, when I was licensed in 1999. And I said, I want to look like that person. I had the privilege, I had the honor, and I am so grateful that when I was 26, I worked at 2 community medical clinics. And you hear me say that sometimes in some of my other videos. I worked at Samahan Community Medical Clinic in San Diego. There are 2 locations, Mira Mesa and National City. I don't know if they're still there, but I believe they were FHQCs. They were especially for low-income community clinics. They were for the low-income neighborhoods or people who didn't have insurance. Samahan was created by Filipino doctors in the 1970s. This is what I remember, and this is what I was told by the medical director at the time. It was created by the 70s by Filipino medical doctors who wanted their parents to come here from the Philippines to take care of their kids. I'm one of those kids because I was born in 1973, and at that time in San Diego, it was primarily a Navy town. You think of Top Gun, that's where it was, San Diego. In fact, just a couple of weeks ago, I was in Oceanside, and they were, it says right there, when you're in Oceanside, Top Gun. And so that's where a lot of Filipinos, because my dad was in the Navy, and so were quite a few other people in my family. That's where they were stationed, 32nd Street. And so they would bring their parents here from the Philippines, our lolos and our lolas, our grandmas and grandpas, and then they would take care of the kids. And so they needed medical care, so they would go to Samahan Community Medical Clinics. Those were clinics that were primarily Filipino doctors who would take care of our elderly. So, when I was there in 1999, 2000, after watching Patch Adams, and I said, I want to be like him. I want to be like that guy who's making people laugh and funny and just doing things a little bit against the grain, very much like my personality. And I did that. And while I was there, I had the privilege to see what the average patients that I had was 75. The average age. A lot of them were in their 80s and 90s. And there were people in their maybe their 40s. You have to understand, when you're 26, when you're 40, 50, that's old. But now that I'm 50, it's like it's not that old, but I got to see who I wanted to look like, and I got to see who I didn't want to look like. I got to see how I wanted to age. I got to see how I wanted to behave, what kind of activities I wanted to do in my life as I age gracefully. And I can tell you, people just don't become billionaires by accident. It's by design. When we decide to grow old, the money in your bank is by design. Your thought processes, it's by design. You landing, in certain places in your life, Whether it's in a mansion or in prison, that's by design. It's not just from luck, whether it's good or bad. They're a series of choices you made that got you to a place. So it's important to, like I tell people, I'm very excited. I've been doing jiu-jitsu for a long time. I didn't become a brown belt by accident. My husband didn't become a black belt by accident. My daughter, I have 3 children. They all have trained. And my middle child's not a yellow black belt by accident. She's not winning platinum and getting these, little scholarships as a dancer by accident. She dances 13 hours a week. And she still trains jiu-jitsu. She does well in jiu-jitsu, not by accident. Her scoring so well in her dance solo and she's in 4 teams, including her solo, that's not by accident. Their team getting first place is not by accident, it's by design. Yesterday I received a text from one of the moms. You have to understand that as a parent, as a mom, I graduated 2018 with my oldest daughter's high school with those parents. And my daughter's 2000, she's a 7th grader, so, and she'll be 8th grade, then 4 more years. So in 5 years, I will be graduating with those parents. And then my son, who just finished who's about to finish his 2nd year in kindergarten, 12 years from there, I'll be graduating with that high school group of parents. Why do I share this? Because every group of parents, every class I have to make new friends with. I got a text yesterday, got a message from one of the moms in the kindergarten class asking me if Tommy's been getting pretty much bullied by a boy, a particular kid, some other kid. And I asked him, I'm driving. I start driving after I read the text. And I wait for a while after we're driving, just really think about, okay, I just read this. After I picked him up. And I said, hey, does this person ever make you feel badly? Does he say anything bad? Does he push you? Does he physically hurt you or whatever? And he said a little. And he told me exactly. But it didn't seem like it was a big deal because my son is very expressive, both physically and mentally and verbally. And he said he used to do this, and I told him, if anyone pushes you, if anyone, says anything, I tell him what to do. And I'm not concerned about him. Why? Because it's by design. Why is it by design? When you keep saying, what do you mean by design? Well, he started doing jiu-jitsu in August 2 years ago. And I'm an assistant coach in his class, so I see his progress. And he's also taking classes in other jiu-jitsu classes. So he knows what to do. He's 6, and he sees his 13-year-old sister train jiu-jitsu, and he sees her fight. And he has seen his 20-year-old sister still take personal protection classes. And he sees her, almost break my arm. He sees mommy assisting class. He sees mommy taking class. He sees mommy teaching, helping the teenagers class. He sees mommy fighting. He sees daddy, well, they're in 2 different things, but he knows that he trains. And he's around powerful men. I specifically put him around powerful men for a reason. Men who are strong, men who are much bigger than us, so he can see I can be like that. I can fight like that. It starts happening now. It's by design. So he's not being conditioned to be bullied. And he's also not getting conditioned to be a bully. That we will not tolerate that. So when I'm giving this as an analogy, because if okay, people don't become whatever their martial art of choices. They don't just become black belts by accident. It's by design. It's what you do, what your activities are on a daily basis. It's your habits. So it's how you show up at work. It's how you show up in your recreational stuff. And so if you decide, when I'm 50, 60, 70, 80, 90, my oldest patient last year was 99. That's by design. It's not, it didn't just happen. I have a 90-year-old patient who I got her back on her horse, and I did a video on that, on her Arabian horse. Hip pain, none of the needles went to her hip. She was back on her horse after 5 treatments. That's almost everyday treatments. I watched, watch that video. Just look up Anna Dolopo on YouTube and look up horse. She got back on her horse, 90-year-old woman back on her horse. That didn't just happen. I fixed something back in September 2023, so she knew I can fix this. And why did she have faith in me? Well, after having 4 kids, she got her doctorate of nursing. She's one of the original nurse practitioners, and she has faith in me. When she came in February, she knew I fixed something back in September, that I'm not like let's kind of manage it. No, we fix things here. So she said, I need you to fix my hip. I said, all right. And then we did. And that's a whole, YouTube video. You can watch it there, and it's also on my website. Go to elementsinharmonyacupuncture.com, and I believe you can just search for horse, and you'll see that case there. So it's how you show up for yourself that really helps you grow old gracefully. It's what you do now. I am very interesting science project, in the sense that I have been getting acupuncture 1 to 5 times a week since I was 20, and now I'm 50. So I don't know anyone else, even other acupuncturists, who can say that. And if you are that person, I'd love to meet you. And if you've been doing acupuncture 1 to 5 times a week for the last 30 years or longer, I would love to meet you. Because when I hear of people who don't invest in acupuncture for themselves, yet they're practicing, that tells me something. I want to practice what I preach. When I was, there was a time, actually, when I was pregnant with my first child, and I was scared to treat myself. So during that time, I didn't treat myself, and I had the worst pregnancy for the first 5 months. And it wasn't after I gave birth. I was concerned about putting needles in myself, because we didn't really train when it came to pregnancy care while I was in Chinese medical school. But then there's this amazing, who's now midwife, Lindsay Mealis. Go to Orange County Midwifery. She's on my website. If you look up elementsinharmonyacupuncture.com, you'll see fertility specials. And I want to make sure, she sends me so many referrals. If you go down, you'll see quite a few different referrals. You'll see midwifery referral, OC midwifery, and then it's orangecounty.midwives.com. Just click on that, and it'll go straight to her website. She sent me, she was my doula, and she was my midwife for the next 2. She was my doula from 2003. I gave birth May 2004. And since then, she had sent me literally, if not at least 1,000, hundreds and hundreds of patients since 2003, easily. And I became so proficient and very effective, and very, my precision in treating low to high risk pregnancies is far more than if I hadn't been thrown into the fire. She had sent me so many patients. So with my second and third, I treated myself pretty much every day, almost every day. And I had marvelous pregnancies when I was 36 and 43 compared to when I was 30 when I gave birth. I was pregnant when 29. That was by design. And so let's talk about time, money, health, time, money, relationships. Dr. Tan would always talk about that, and health and freedom. I'm a doctor of acupuncture and Chinese medicine, so we're going to be really talking about your health. There are people who are in a lot of pain, and whether it's because, whatever the hang-up is, whether it's because you've been an athlete for so long and you didn't, do the self-care required, the right supplements, or, maybe you didn't recover well after some surgeries, that's still by design. I add to that health and freedom, time, money, relationships. I add to Dr. Tan's formulas or his concepts, health and freedom. My focus is health. It's to get you back on that vector. So let's say you want to have a baby. I specialize in the most challenging fertility cases. A woman conceiving after age 35, just by accident, that doesn't just happen. That means, your health was pretty great for you to conceive naturally after 35. That means everything's going well. when I was 42, it was 2016, and I was yelling on a video saying, you have to have conviction that you